Battling a worldwide pandemic that had reached southern Nevada, our healthcare workers found themselves working around the clock to save lives, contain the infection, and protect the rest of us from exposure. I sat down with those who lived through the unthinkable firsthand.
If I'm in ICU, then it's usually in ICU somewhere about 5 in the morning and kind of assessing each and every patient in the critical care unit.
The day-to-day for Dr. Raj Amasur can vary, but 5 years ago in March of 2020, his routine started to look very different. As an intensive pulmonologist, he's used to high-pressure environments, but serving on the front lines of the COVID-19 pandemic brought an extra level of intensity he never imagined.
I had to change completely in my garage and run to the shower, and then for a period of time, isolate myself from my family. Had other colleagues that, slept in different rooms.
The first presumptive case of the COVID-19 virus was reported in Nevada on March 5th, sending all of our state's healthcare professionals into overdrive. Chris Loftus, who was the CEO of Desert Springs Hospital at the time, remembers where he was when news of Clark County's first case reached him.
Right around that time every year, our company does a healthcare conference. So I had just flown to Philadelphia. Literally within the first 5 minutes of our very first presentation, all phones go bing, 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 and it says, first identified COVID patient at Desert Springs Hospital. Outside of the VA, so in terms of the public hospitals, Desert Springs had the first COVID patient.
Communicable disease manager Kimberly Franich.
We had prepared as much as we could possibly prepare, given the unprecedented explosion of what we were about to see.
That viral explosion happened within weeks of the first positive test. Clark County cases began to spike by the thousands.
Between 2018 and 2020, I was working in 2 different ICUs in the hospital system here. Ranged from anything from, on a light day, 15 to 20. On a heavy day, maybe 30. Pandemic days were 50, 60. It was just high volumes because you're always on the go.
Many of our facilities had over 100 COVID patients. You just saw lots of different emotions as you went through it.
I think the reality of having that first positive person and having a person be really very severely ill. I mean, it's a scary thought, even though we work with infectious disease and communicable diseases all the time.
As the weeks of fighting the virus 24/7 dragged into months and years, it took a heavy toll on our first responders at the front line, both emotionally and physically, from the hours and hours spent wearing personal protective equipment.
You wear something tightly gripped to your face for 15, 16, 18 plus hours. You take that off and you're touching your ears and you've got raw spots on the back of your ears and, pain around your face just from the sheer pressure.
To being at the bedside of patients battling COVID-19 alone.
I remember, many cases when patients were in the hospital, their loved ones couldn't visit.
To the stress of making sure they didn't catch the disease themselves. Today, 5 years later, Amasur, Loftus, and Franich reflect on the lessons learned during that tumultuous pandemic.
I think, the biggest lesson learned for everyone is that, hey, we can do this. We can handle this.
What we knew then, but what really came into play is that public health is not successful without our community partners. We really partnered with everyone and everybody became a team.
Everything that came with it has taught us a lot about relying on each other, getting through the struggles together. I think it only makes us stronger.
Franich says 5 years later, it's still important to wash your hands, stay home when you're sick, and get vaccinated when possible to keep yourself and our most vulnerable populations safe. In the studio, I'm Anissa Bohannon.